Hello, my name is Joan Moore and I'm presenting my integrative review project for N890. My objective is how modified CBT can decrease anxiety among high-functioning autism spectrum disorder school-age children. Autism spectrum disorder can affect cognitive, social, and communicative skills. These children have increased sensitivity to their surroundings, causing difficulty adjusting to changes. Anxiety is one of the largest comorbidities that ASD children can be faced with, impacting their school, relationships, family functioning, and self-care aspects, negatively affecting their quality of life. According to the CDC, 1 in 68 children aged 8 was diagnosed with the disorder in 2010. Healthy People 2020's objective is to decrease the number of individuals with disabilities who report serious psychological distress. The National Institute of Nursing Research priorities to improve the quality of life by managing symptoms from acute and chronic illness. If anxiety is left untreated, ASD children are also at an increased risk for unemployment, substance abuse, and other psychiatric problems later on in life. CBT is considered the gold standard when treating anxiety with children. The clinical question is, in high-functioning ASD school-age children, how does modified CBT compare to no modified CBT affect anxiety levels in 6 months? I've reviewed 3 randomized control trials to answer this question. The first study evaluated the efficiency of modified CBT, called Behavioral Interventions for Anxiety in Children with Autism, compared to treatment as usual in 45 high-functioning ASD children, ages 7 through 11 years old with clinical significant anxiety. Children were randomized to receive 16 weekly 60 to 90-minute sessions of modified CBT or treatment as usual. Measurements were done at baseline, post-treatment, and at 3-month follow-up. There was a 75% response rate to treatment, 29% anxiety reduction and improved functioning, 38% remission from anxiety diagnosis, and 73% retention of treatment at the 3-month follow-up. The limitations of the study included that there was a small sample size, there was variables in the treatment as usual group, and there were drops in assessment scores between post-treatment and the follow-up group and the treatment group. The second study randomly assigned 22 high-functioning ASD children in a copycat program that was modified for the ASD child into 16 weekly 60 to 90-minute sessions of modified CBT to a waitlist group in ASD children ages 8 through 14 years old with anxiety. Children were assessed at baseline, post-treatment, and at 2-month follow-up. The findings showed that 58% of the children receiving CBT no longer met the primary anxiety diagnosis, and 36% remained free from primary anxiety diagnosis at the 2-month follow-up. The number needed to treat in this group was 1.72. The limitations of the study included small sample size, parents were not blind to treatment, and there was a drop in assessment scores after post-treatment to follow up. The last study evaluated the effects of modified CBT intervention on 50 high-functioning ASD children ages 7 through 14 with significant anxiety that were randomized into a 12-week family group session with other peers or treatment as usual. Measurements were done at baseline, 2-week post-treatment, or 3 and 6-month follow-up. Findings of this study concluded that there was a 50% response rate to treatment. Reductions in anxiety symptoms in the treatment group were maintained at the 3 and 6-month follow-up. The limitations of the study was that there was a small sample size, there was multiple treatment as usual variable groups, and there was a lack of control in the use of therapists and trial measures. The conclusion of body of literature that these studies shows and how it can support nursing practice is that modified CBT can be effective at reducing anxiety in high-functioning ASD children. Engaging and including families in their child's care is critical for the child's well-being. Teaching parents and children about the disease process and managing techniques is also important. The studies show the importance of relaxation techniques and cognitive restructuring. The literature also showed the use of visual aids and social coaching can be effective. The studies also show that booster sessions are needed after completing the 16 weekly sessions of CBT to remain how anxiety was reduced. The proposal for the intervention would focus on a target population of school-age ASD children who have clinically significant anxiety who would receive 16 weekly sessions of both individual and group sessions that would last 60 to 90 minutes long, a modified CBT provided by a mental health outpatient provider or a psychiatric mental health care provider in an outpatient setting. Thank you so much for listening.